So you're thinking about starting therapy, yet you haven't yet, probably due to fears and apprehension because you don't know what to expect. This video is for you. Hi, I'm Nicole. I'm a licensed psychotherapist, and I'm here to dive into exactly what to experience in your very first session. This way you have a lot more confidence when you go into it, which will help you have less stress and less anxiety, knowing exactly what to expect. So there's different parts to your very first session. There's going to be the paperwork, building trust, gaining background information, diagnosis, sometimes a treatment plan, and then scheduling. Let's go into it a little bit further. With your consent forms, the consent forms are going to go over all of your rights and guidelines to therapy. So you have the right to confidentiality, understanding guidelines of maybe where you cannot have sessions if you're doing virtual sessions, if there's a cancellation fee, how to schedule, all the logistics of your therapy. It could also be release forms, and the release forms may be for like if you're on medication. So your therapist may want to talk to your psychiatrist to understand more about your medication side effects, things like that, talking to your doctor. And sometimes it could be just gaining collateral information, so more background information from other people. That will lead into our very first question that all therapists will ask is, so what brings you to therapy? By asking this question, it helps us understand where you're coming from. What are your symptoms? Was there an event that happened that brought you in here? What are your concerns? And these will help us understand where you're at, to meet you where you're at, and to know where you want to go in therapy, what your goals are. This is going to help us talk a little bit deeper so that way we can build that trust, because it's really important to have a therapeutic rapport, to have a relationship with each other. So that way you feel comfortable and you feel completely safe to open up. This will lead into deeper conversations, which is called the biopsychosocial. That is just a fancy word for background, all information that encompasses you. This is going to be questions such as, briefly describe your childhood. Was it happy, chaotic, troubled? What was your family composition like? What's your relationship dynamics with your family members? Any family history of mental health issues, concerns, or substance use issues? What is your substance use? Do you do recreational drugs? What is your medication history? What medications are you currently on? Have you ever been in therapy before? Have you ever had a diagnosis before? Have you ever experienced trauma, whether it is mental, emotional, physical abuse, or whether you've witnessed abuse, but ever been in a really bad car accident? So it's going to be gaining so much background information to know the whole you. With all of these questions, it's going to help us understand your symptoms, your thought patterns, your behaviors, and all that information will help us be able to narrow down a diagnosis of what you're experiencing. That diagnosis will help us gear towards making the treatment plan. The treatment plan, I usually always do it in my very first session. Some therapists will wait till their second or third session, just depends on the therapist. But the treatment plan, I work with my clients on the treatment plan. We work on it together to understand, well, what is your goal? What do you want to gain out of therapy? And then we write the objectives. What are the things specifically we're going to do to get you to your goal? And then, of course, we work on scheduling. Is it going to be weekly sessions? Is it going to be bi-weekly sessions? And hopefully all that information, I know it was a lot, hopefully all that information makes you feel a lot more comfortable, a lot more confident in your decision to move forward with therapy and to start your own healing journey. If you have any comments, if you have any questions, please put them in the comment section. If you have questions that I can help address to make you feel more comfortable in your decision to move forward with therapy.